Good afternoon, everybody. It's Travis Bethel. Welcome to the HI August office hours. Just wanted to let everybody know I just started recording this session, so it'll also be available on our HI website training page in the near future. And if you have any questions or anything you want to talk about along the way, feel free to use the chat function or unmute yourself and ask your question or have your comments. So we'll get started. So we'll go over some policy and procedure stuff today. COVID-19, as usual, we have topics each month on that. Talk a little bit about our data den, our health, home, business intelligence rollout, how that's coming along, and then we'll touch on some NetSmart topics as well today. So policy and procedure wise, we had one policy and procedure just come out in the last week, actually, since our last time we got together a month ago. And that's the activities and billing protocols for newly referred members in an excluded setting. And this policy and procedure pertains to both adults and children. I'm going to have Jessica go over that policy in one moment here. But before that, I just wanted to touch on what's upcoming for policy updates. We have our HARP policy, which we're waiting for more finalized information from DOH, and we'll get that out and updated. Our notice of decision of fair hearing, quality assurance and performance improvement, and then staffing qualifications. So those 4 policies will be coming your way as they get updated. Jessica, did you want to touch on the excluded setting policy for folks?
Yes, thank you, Travis. So this policy pertains to newly referred members, but it also touches on billing and pending for members who enter an excluded setting, which is also covered in our diligent search policy or our continuity of care policy. We get a lot of questions about billing and pending members. So I just wanted to remind everybody that when you have a member who enters an excluded setting, so whether it be a hospitalization, a child enters an RTF, it could be a rehab facility, the month that the member goes into that facility, you can bill. So even if, as long as you provide that member a core service that month, you can bill the month that they enter that setting. Then you can also bill the month that they come out of that setting. And the theory behind that is that you are helping coordinate getting them into that facility. And then the month that they leave, you're billing because you're helping discharge them from that facility. So you want to make sure that if you have a member who is going into that setting, before you pend them, you want to make sure that if you've provided a billable contact and you've met your minimum core services, that you bill and then you would pend them if they're going to be in that facility for longer than 30 days. So if you have someone who enters, let's say, the hospital on the 10th of the month, you can bill for that month, let's say August, they enter on August 10th. It's now August 31st and they're still in the hospital. So now you've billed for August because you can bill the month that they go in. Now we're going into September. In September, you're going to wait to pend them until you know if they're going to be in there the entire month of September. If they're going to be discharged in the month of September, you're not going to pend them because you're going to be able to bill and work with them in the month of September because you're going to help discharge them from the facility, which is billable. If they're going to be in inpatient or wherever they are for the entire month of September, that's when you would pend the member and kind of hold their status. So when they are discharged, they can come right back to you right into an enrollment segment. This goes for any type of excluded setting, except if someone were to enter jail or be incarcerated. You can bill the month that they go in and the month that they come out, as long as you provide a core service before the incarceration, and when they come out, as long as their Medicaid has been reactivated, which you would check in e-paces. So you just want to remember that when you're pending these members, that you want to wait to make sure that they're going to be in there a full 30 days. And that's like a full 30 calendar map days. So remember, everything reverts back to the first of the month, or in the case of a discharge, to the end of the month. And then whenever someone goes in or comes out, you can bill for that month that they go in and that they come out, as long as their status is enrolled. Once you switch it to penned, you will not be able to bill. I just know that this has come up. We've been getting at least a couple questions a week on it, and we just so happen to have this updated policy. And then this also falls in line with continuity of care. So if you have any questions, you can email us, but I hope that that clarifies some things.
Thank you, Jessica. Did anybody have any thoughts, questions, comments in regards to the excluded setting policy or any other policies? Okay, well, you know where we're at. If you do have questions, as always, the link to our care management policy and procedures webpage is at the bottom of the slide. That's where we have our most recent policies and procedures for folks for a quick grab. If you're out there doing your thing and you had a question and you weren't quite sure, you can use this as a resource as well. So COVID-19, so this I had up last month. It's going to segue into the next slide as well, but I just want to remind folks that New York State Governor Cuomo, when he was in office, did expire as of June 24th, the disaster emergency for New York State for COVID. And relevant to the health home, that's going to New York State DOH is going to continue to work with us and at least give us 30 to 60 days to, transition back to quote unquote the norm of how we follow through on like consents, face-to-face visits, et cetera. So that's not a hard stop. So we'll have a little buffer once DOH makes us aware of that. That this also put in effect that electronic signature and verbal consent was still okay, and we're able to do that. But the caveat behind that for non-Health Home Plus members that receive Health Home services is that we should be trying to do face-to-face where appropriate and safe. But we do have the ability for electronic and verbal consent to continue at this state in the game. So just wanted to make sure people kept that in mind as you're working towards, face-to-face where is appropriate, working back towards obtaining wet or electronic signatures for folks. We still have this buffer for verbal, but we should be working back towards the actual signatures as much as possible, or electronic signature of the individual we're working with. So that leads us to Health Home Plus members. So OMH on August 4th sent out the memo that you see here. And basically it's an extension to the DOH waiver that was sent out prior that we just talked about. And this is specific to Health Home Plus. And basically this memorandum is saying that face-to-face should be encouraged and done as much as possible, unless there's a health and safety concern otherwise. And there's a hard stop on this one. The commissioner for OMH actually on August 24th put out a memorandum. Basically, there was a commissioner's regulatory waiver that said 60 days from 8/24 of 21 that the face-to-face requirements for Health Home Plus member for Health Home would have to be back in effect. So that policy procedure that stood for interactions with Health Home Plus members, as far as the two face-to-face interactions, will have to be back intact no later than 60 days from 8/24. So that rolls us through 10/23 of 21. So by 10/24 of 21, we're going back to what was required prior to the pandemic, unless the commissioner through OMH changes this. That's the hard stop. So we have the 60 days to move forward to that. It's also noted in there that if we can't do face-to-face for Health and Plus members, and this is specific to adults, and I pull this quote, if you will, from the memorandum, if the in-person contacts pose a health or safety risk, you should continue to meet with clients using telehealth, both audio and visual, audio only, provided clear risk-benefit determination is documented in the record. So they want documentation, which we've talked about in general. We should be documenting in the record when it comes to face-to-face. If it doesn't happen with our members as we're working towards that requirement again, there's really a risk assessment that needs to be done on a monthly basis, on an individual basis before a face-to-face occurs, to say whether or not that should happen. So through the memorandum, there's the risk benefit assessment. So I have the link to that here. It's also in the memorandum that came out through on OMH on August 4th. And it's really getting into doing that pre-COVID screen a day before or within 24 hours of conducting that face-to-face with the member. It's going through, reasons why you wouldn't be able to have that face-to-face meeting. So you get really justified through the reasoning that's giving. It starts on page 5 of that risk benefit assessment. If you were to go into it, and it's called in-person encounters. And I might be able to pull that up actually. See if I can do that here now. And show folks if it's willing to pull. Can folks see the screen, the Office Mental Health Infection Control Manual?
Yes, we can see it.
You can, thank you. Okay, so I'm going to scroll down. So this is what was sent out through the memorandum on August 4th. So we get down to page 5 when we get into in-person encounters. So it starts to line out here, appropriate for telehealth, including when you get down to the first bullet under that section, the person's cognitive capacity, access issues, establish a private space. So you really get into the logistics of why you could or couldn't meet with that person. Attention to the impact of different technology platforms, their ability to take more active role in treatment, infection control on the next bullet. Has the person been vaccinated? Were other people living with them? Have they been vaccinated? Have they recently traveled outside the United States? So those screening questions, we do have that COVID screen in NetSmart that we've encouraged folks to use. If you didn't have an internal screen that you use through your organization, it is in NetSmart as well for folks to do prior to meeting with the members that they're working with. Clinical factors, the bullet under that, just getting into different aspects clinically that would either prohibit or limit your ability to see that person face to face. So really what's happening here is OMH is putting some pretty, bulleted, factors here that would be in play to make that determination. And if you can't meet face to face, you got to document why in the record. That's the other request that's happening. 1 day prior to an appointment, here's that pre-screen that I just talked about, asking questions in the last 4 days. Have you traveled outside the United States? Have you had symptoms? Any infection risk to others in a program? Then there's a whole section on in-person clinical services that walks through things that OMH is looking for and would like to see for people to assess prior to face-to-face. So this tool is available through that link that I had brought up, and try to minimize this now. So are we back to the slide deck now, folks? I just want to make sure I got you back.
Hey, Travis, it's
Yes.
Jessica. I don't think, I personally could not see what you were scrolling through, but I thought it was just my computer per usual, but I don't think everyone saw that document.
Not everyone saw it? Okay, so let me try and share it another way. One moment. Can everybody see this document?
Yes.
The
we can
August
see
4th?
that.
Yep.
Okay, so this is the memorandum that came from OMH on August 4th that's outlining what I've been talking about. And then within that, there's a link that says, please refer to the OMH infection control manual. So let me punch on that. And that was what I was just going in depth. Sorry that I thought that folks could see it. See if that comes up now for everybody. Can folks see it now?
Not yet, at least
Not yet.
on my end. Oh, someone said yes.
I can see it.
Maybe it's
Okay.
just me, because you know how lucky I am.
I can see it.
Can I get 3 more yeahs and then I'll feel confident?
Yeah.
This is Taylor. I
see
just see the original document. I didn't see the infection control manual come up.
Same
So
with me. This is Ashley.
You can't see the infection. Okay, so let me see this here. That's interesting. Some can see, some can't. All right, so let's go. All right, how about now? Can you see it? This is Office of Mental Health. It's got blue and white.
Yes,
Okay.
we can see it.
Yep.
Okay. Can I get 3 more yes?
Yep.
All right, great, thank you. So this, sorry about all that. But anyhow, so this is the actual manual for public mental health systems programs that OMH had through that link that was in the memorandum. So if you go down to page 5, that's where we start to get into in-person encounters, what they're asking for folks to look at. So as I was mentioning before, there's different bullets. So you see in the first bullet under in-person encounters, factors related to the client's appropriateness for telehealth. So you should be assessing these types of components. If you were to do telehealth, infection control, looking at whether the person has been vaccinated, whether people living with that person, if they live with others, have been vaccinated, whether the person's traveled outside of the United States, they had negative COVID test, program ability to access PPE. And I'll jump to the bottom, the risk factors and people living in the same household as a client. Then clinical factors, the next bullet subheading, just different variations for clinical factors, systems factors, attention to issues regarding continuity and transition of care, including in-person visits as needed to avoid disruptions. So it's really starting without reading all this bullet by bullet. It breaks down different things to be asking, assessing when you're getting ready to interact face-to-face with a Health Home Plus member. So this is specific to Health Home Plus. Day prior to that in-person appointment, doing that COVID screen, I had mentioned NetSmart has the pre-screen in there that you could do for the individual for the record. If you don't have an internal screen that you use already as your organization, we encourage folks to use that screening within NetSmart Care Manager. And it's really asking those questions through the pre-screen just to ensure that person's not knowingly actively positive as far as COVID-19 and or been in contact with others who are positive. And then you get into the in-person clinical services on the next page, just breaking down the things to look at around there. If you're looking at a clinical type service for in-person, which I won't read every one, I'll let folks look into that on their own. But it just starts to break it down, and it goes into different other types of programming as well. At the bottom of page 8, assertive community treatment, mobile crisis forensic transition programs, other specialty services. So This assessment is being requested through OMH to be looked at, to be assessed before you're doing face-to-face with folks. And it can be found through that link and I can also send that out when I am sending out the slide deck as well after the meeting, just so folks can have that actual document outside of the link in the deck. Is there any questions around it? I mean, we got a hard deadline is what it comes down to for Health Home Plus members, which is going to come down as of 10/23. So by 10/24/21, all pre-COVID-19 waivers around face-to-face for Health Home Plus members is going to no longer be in effect. It's going to go back to 4 contacts, 2 of which have to be face-to-face on a monthly basis. Anybody have any questions or anything along that?
Hey, Travis, I just heard you say 4 face-to-face visits. I'm sorry, was that for Health Home Plus, or was that for the
No, it was,
SPOA folks? I'm sorry, not the SPOA folks, but the AOT folks.
Yeah,
I
the
was-
4 face-to-face is for AOT, and then the Health Home Plus is 4 contacts, 2 of which have to be face-to-face.
yeah, I think you caught me at the end of saying that, Bob, 4 Health Home Plus members, I think it said, or something like that. But it's 2 face-to-face contacts a month for Health Home Plus of the 4 contacts in that month that you have to have. So 2 of them need to be face-to-face.
Okay,
Unless
thanks.
otherwise, as Jessica had said, they're AOT category.
Okay, great, thanks.
Yep. Any other questions around that? Okay. I had this slide up the last couple months as well. I just want to bring it up again. You know, we are just reminding folks we are able to do verbal consent at this point. We've got 60 days still to get that written or electronic signature. We have to document that once that signed consent is obtained in the record. So I just want to make sure folks are doing that as they're getting those signatures, striving to meet those timelines, because there is going to be a point. I know we just talked hard deadline for Health Home Plus members for face-to-face visits, but there will be a point where DOH is going to pull back on the the verbal piece, and I just don't want people to be in a situation in your organization where you've got all kinds of verbal consents out there, and people have gone over 60 days, or you're not able to get the signatures, and it's just going to open up a whole nother bucket of worms, that we don't want to have to get into. So just trying to be proactive about that. DOH is saying they're going to give us that 30-day up to 60-day window once they do pull back the waiver for verbal. So we'll make sure we get that to folks once we know. But in the interim, if you could strive toward getting those signatures, getting those electronic signatures sooner than later, that's the ideal route to take. And I'm going to turn it over to you, Data Den.
Now for fun stuff. No, I'm just kidding, everyone. Just apologizing for the delay in our Data Den rollout. We are making significant progress. However, we just want to take all the time we need to fully validate and test the system. So more to come on that. I think we'll probably opt to do a bit of a slower rollout. We may just kind of cluster CMAs together and do more like a more smaller scaled training, but we are making progress and looking forward to a rollout in the near future. Thanks for your patience.
Thank you, Ann. So more to come. So related to NetSmart, we had a few things we wanted to bring up this month. So member problems transferring between episodes. So I think it's going to be as of by the end of the week anyways, but possibly by Wednesday of this week. A member's identified problems will not transfer from one episode to the next. So any new like enrollment, new members coming in as they change or start a new episode moving forward, problems aren't automatically going to slide over to the next episode. So we just want folks to be aware of that change that's coming. We're working with NetSmart currently to establish that. We were looking at some point this week to do so, hopefully tomorrow, but we haven't heard for sure yet if that's happening tomorrow. And just wanted you again to be aware that that is going to be a change. The next thing is around the other comments field when pending a person. So we're getting errors as a health home when we do our tracking. It's like a rejection notice that comes through, which just creates other issues when we're trying to do billing and download members and make sure it's matching between MAP and NetSmart. So NetSmart's working on a solution to this, but right now we're just asking folks, if you're going to pen somebody in NetSmart, don't put any comments in the other comments section at this point. If you could hold from doing that till we can get a resolution through NetSmart so that we can avoid getting tracking rejections in the system. I don't know if there's any questions around that or comments, but it's something that's starting to create issues on our end, and we just want to get it remedied before it becomes a bigger issue for us. Okay. And then the last thing on NetSmart is around health home referrals. So any referrals that come to the health home as we're moving forward and put into NetSmart, we're going to put them in as an assigned status. And once the client search note is completed, the person will be entered into MAP. So we're asking that health home service providers not enter members in MAP any longer, that the health home goes through that and does that as we move forward. So we would be putting those referrals in to NetSmart and an assigned status for folks. But if there are any questions or thoughts, comments around that. Okay. All right. Well, if you have some, please reach out and reach out through the health home email, and we're more than happy to talk through those things with you. And then just moving on to questions or general discussion. If anybody had anything they wanted to talk about, there's a lot of people between time off and juggling many priorities right now. So, it's that time of year, especially. I don't know if anybody's had any challenges in general with the uptick with the variant in your particular area of the region. I know we've seen this spike in cases in the Warren County area, Saratoga County area quite a bit. So we're working through that down here. I don't know if people are experiencing that in other counties. Well, that's good if you're not. If you are, just be safe and use precaution as we all have been. Other than that, if anybody didn't have anything else, I just wanted to thank everybody for their time today and all that you do. And we appreciate you taking time out. Thank you, everybody.
Thank you.